Hello. Welcome to Public Health Week at Rainier Beach High School. I'm Jane Simpson, a health center manager for Public Health Seattle and King County, and we're here today at Public Health School-Based Health Center here at Rainier Beach. I'd like to introduce you to the team and let them tell you a little bit about the work they do. Why don't you come on in? Hi, Laura.
Jane.
This is Laura Stewart. Laura is the nurse practitioner at the School-Based Health Center here at Rainier Beach. Laura, can you take us around the clinic and tell us a little bit about what goes on here?
Sure. Let's go see the exam room. So this is our exam room, just like at any other clinic. And what we do here is we are a comprehensive clinic. So what that means is that we see kids for sports physicals, regular physicals. We see kids that have asthma, acne. We do reproductive health. Anything that you would have done at an outside clinic, we do here. We also have mental health that you will meet later, a mental health practitioner, and we work really closely together. So if I see a kid for a well child check and I'm worried about their mental health, anxiety or depression, or maybe they're a new immigrant and have PTSD, then I can have that woman see them pretty quickly.
Laura, what difference do you see having a health center in the school makes for kids and for their families?
So we've been here for 30 years. I've been here for 15, but the School-Based Health Center at Rainier Beach has been here for 30 years. And because we see kids for all sorts of things, they just come down, they get their needs met, and they go right back to class. So we call it seat time, and they're pretty fast that we know that it's really important that they are in class. And for families, I think it makes a really big difference to know that their kids can be seen here and that they can call us. We have sometimes parents call us and say, hey, can you see my kid for this and that? And their parent doesn't have to leave work or doesn't have to figure out how they're going to get to the clinic or make an appointment, because we usually see kids within 1 or 2 days of when they need to be seen as much as possible. So an example of that is I have some kids that go to specialty clinic either at Swedish or at Children's Hospital, and instead of them having to go get their blood drawn every 3 months or 2 months or sometimes even once a month, then they come and see me and they get their blood drawn and I send those results. And that's just an example of that.
Thanks, Laura. Hey, can you introduce us to the rest of the team here?
Okay, let's go. So this is Mary Kibathi. Mary works for the school district. She's our school nurse, so she sees anyone for anything in the school that they would need. So if someone is going to come and see Mary, then they need no paperwork. But if someone comes to see us, a youth comes to see us, they need to have registration and they need to have consent.
Laura, how do you work with Mary?
So oftentimes, well, Mary and I have a really good example of that from something that has happened recently. So a kid had a really severe allergy attack, an anaphylaxis response, and Mary and I work really closely together. So she can triage and she can say, hey, do you have medication for this person because this person is not doing okay? And then we work really closely together. Yeah.
Thanks a lot.
Sure. Bye, Mary.
Hi, Deborah.
So this wonderful woman I work really closely with her. She's the clinic coordinator, but also my friend. And here she is.
Hi, Jane.
Hi, Deborah.
Hi.
Hey, in addition to keeping the clinic running smoothly, I know that you're very involved in the life of Rainier Beach High. Can you tell us what difference that makes or what impact that has on your work here at the health center?
Boom. No, that's the kind of impact that it has. I'm so silly all the time. It creates the best environment for us to be in the school because, we're like visitors. So, but now it feels like home. And so they have accepted us being here, working with the teachers and everyone else. The students, there's a list of things that I could say. But number one, the students come in and they're looking for Jen, they're looking for Laura, and there are a group of them that come in now because they're like, I just need someone to talk to. And I am just another adult in their life. So they're coming in for me. In addition to that, I'm the announcer for the football games, guys. So I mean, I have really cool opportunity to reach out into the community and establish the relationships, not just with the students, but with their parents. And so the parents know that, they can come in and they can trust us with their children.
Thank you so much.
Yes, you're welcome.
Thanks, Deborah.
Hi, Jen.
Oh, hello.
This is Jen Cantor. She is the mental health person and also my friend, and she works for Kaiser Permanente. So not all school-based health centers, but some school-based health centers have a partnership. So Public Health and Kaiser have a partnership in this clinic.
Jen, can you talk a little bit about how you interact with students and teachers here at the school outside of clinic appointments?
Yes. Well, I'm a part of our Gay Straight Alliance, which means that I get to be one of the adult advocates in the building for any queer youth and just engaging with them and helping them get their needs met, and also facilitating a leadership meeting for them every week. And also I, along with Laura, we on sometimes one, but more like 2 or 3 times a month, we do young women's group during lunch, and we talk about everything from consent to emotional health to boundaries to how to function well in relationships with friends and partners and family members. And the young people are pretty frank with us because they know us pretty well, so they know that they can say anything to us and that we respect their confidentiality. Also, Laura and myself, we both go into the health classroom, and I talk about mental health and how to manage depression and signs to look for if you're concerned that your friends might be suicidal, things like that, and provide resources, and we let them know about the clinic and where they can come when they need support. And Laura can talk about what she does in the health classroom.
And I go into the classroom and talk about anatomy and physiology and reproductive health there, so that youth also know that they can come here and receive confidential services for that.
Thanks, Jen.
You're welcome.
Bye,
My
Jen.
pleasure. Bye, guys.
Laura, one last question. What do you find most satisfying about working at the school-based health center?
Well, really, after being here for 15 years, I have seen a lot of kids graduate. So we always go to graduation, Deborah and Jen and I, excuse me. And because I've seen so many classes graduate, I've seen them when they've started as 9th graders, as 14-year-olds, and really seen their brain develop in a way that is amazing, going from really concrete thinkers to abstract thinkers, and what does that look like, and how are they going to keep going off into their lives. And really, it is such we all feel so grateful that we get to see that development, but also really help them along the way to be able to help with their mental health and their wellness and their physical health, and how they're going to deal with that for their lives for the future.
Thanks so much, Laura. Hearing you and the team talk, it's really a great example of public health in action. That's all the time we have today. Thanks for being with us for Public Health Week, and follow us on Facebook.